Okay, so here are the SI joints right here. It's where the pelvic bones or the innominate bones meet the sacrum. Okay, and you can see them in the back here, and you can also see them in the front. Okay, now these joints have a slight bit of movement to them. Okay, not a whole lot, but just a little bit. I mean, even less than this. This is just an exaggerated demonstration, but they should have a slight bit of movement. And when we walk, our pelvis kind of moves like this. Do, 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 do. Okay, so we alternate from our right leg to our left leg, back and forth. Okay, back and forth. So, and you can see how that sacrum kind of moves around back here. And in the back side, you can see how that creates movement at the SI joints. Okay, so when we talk about SI joint dysfunction, we're talking about an SI joint that is typically either not opening or is closed, is not opening, so it's too closed, or it's gapping too much and there's too much instability there. Okay, so there's lots of ligaments and muscles that attach to, there's ligaments that attach to the SI joint to sort of stabilize it so it doesn't open up too much. And there's a lot of muscles attached to the pelvic bones and the sacrum that help to kind of keep it nice and closed so that it also doesn't open up too much, but it also helps to control the movement of the pelvis. Okay, so those muscles would be all of your glute muscles, minimus, medius, maximus, your deep hip rotators, your pelvic floor, your TFLs on the front, okay, your iliacus that comes in through here, okay, your adductors, okay, so there's a lot of muscles, your hamstrings, okay, so lots of muscles that attach to the pelvis, and all of those are so important in making sure that this happens symmetrically and reciprocally back and forth. So a lot of SI joint problems result from people who are having difficulty getting this alternating pattern. They're sort of stuck one way, and when they want to switch and put their weight on the other leg, it won't exactly go. And so that's where that you get sort of this irritating, shearing, inflammatory effect on one of the SI joint. Typically, sometimes it's both. Okay, and it makes walking really challenging, and it makes running really challenging. It makes picking up one leg and putting it up on a box or to shave your leg or something. It makes that really difficult to do because these just aren't able to reciprocally move. Okay, so there's a lot of reasons why that happens. These pelvic bones need to be able to move in and out, forward and back. The sacrum needs to be able to tilt forward and back. And so these are things that a physical therapist can help you understand on your own body, what exactly is happening in your case. And if you're interested in my case study on the SI joint, we're going to be going through all of this in much more detail in terms of how this moves, what moves it, and how to correct some of those imbalances that people are seeing in their pelvis and potentially causing some SI joint issues. So join me and sign up for that.